Good morning, and welcome everyone. Good morning. Um, Thank you so much for joining us this morning. I wonder if people need a minute or two to jump on. Um, Good morning and welcome everyone. We are certainly elated that you could make time in your hectic schedules to join us this morning. My name is Rachel Bukasa and I'm the National Director of the Black Sash. And this morning, what we wanted to go through was just first the realization that the pandemic has brought about it an interesting and challenging period in the social justice space. South Africa historically, having a rather poor social relief measures in place, found itself scrambling in an attempt to put measures in place to alleviate the impact of the pandemic and the effects that subsequent lockdown had on an already struggling population. What we saw was lockdowns and stay-at-home orders clearly aimed at curbing rapid transmission of the virus, but it resulted in serious job losses and endangered the livelihoods of many in the country. Black Sash acknowledges that the government's rollout of the temporary COVID-19 social relief of distress grant to those who had little or no income and did not benefit from other means of social assistance program or the UIF, for example, was and continues to be a significant intervention, a new intervention. So as Black Sash, we welcome this rollout as a first step towards a permanent social assistance for those between 18 to 59 years old with little or no income. And our government is clearly slowly moving towards the progressive realization of social security. While we are pleased with the recent presidential announcement which reinstated the grant, which also will now be extended to caregivers, we unfortunately regret that it was terminated in the first place, given that the reason for its existence continued to be present, which was the pandemic at the time, currently as well. Black Sash has long identified the vulnerability of the unemployed in a context where the economy offers limited prospects of job creation, which has been worsened by the pandemic. So Black Sash was keen to investigate when the grants were rolled out. Black Sash was keen to investigate the impact and the challenges that the grant and its rollout faced. The investigation with the grant and all the things around it is essentially what has culminated in the launch of this report. So joining us this morning to discuss the report and to discuss its findings in the different aspects of it, I would like to introduce our four panelists who are here with us this morning. May I introduce first Nelisiwe Gaba. She is a certified paralegal field worker and has worked at the Black Sash since August 1991. She is based at the Black Sash KwaZulu-Natal National Regional Office and is involved with advocacy, community-based monitoring programs, and works closely with community-based organizations in KwaZulu-Natal and Mpumalanga, and is a mentor to many, many community workers. Secondly, we have Agnes Senona. He has a background in who has a background in economics and has been active in the sphere of social security social protection for the past 13 years, focusing particularly on social grants and early childhood development. He was previously employed by the Department of Social Development and international organizations, including the United Nations agencies and Save the Children South Africa. Through his work, Agnes has contributed to the development of social protection policies in various countries in Southern Africa. He is committed to basic income support activities and encourages more people to join the movement. Lastly, second to last, we have Erin Torkelson. I'm so sorry. She's a lecturer at Durham University in geography and a research associate at the University of the Western Cape in geography. Her research explores how social grants have been attached to the logistics and imperatives of debt finance capital. She examines the everyday practices by which grant recipients navigate their entitlement to social assistance against the pressures of expropriation built into the payment system. Lastly, we also have Dr. Wanga Ngabile, a specialist scientist in the Health Systems Research Unit at the South African Medical Research Council. She has a DPhil in social policy from the University of Oxford. Her main interests are research, teaching social policy, specifically as it's related to poverty, inequality, health, and well-being. Black Sash Research Project Committee. I would also like to just acknowledge at this point, we have Lynette Mart, who was a former national director. I would also like to acknowledge Huda Abrams-Faker, National Advocacy Manager, and the other Teresa Alderman, as well as the 4 panelists I had just introduced. So thank you so much for joining us this morning and really welcome. I would like to—
Hello?
Yes, Nelly, we can.
Do you see me? Okay, thank you so much. Okay, what happened here when this grant started? People were unaware what's going to happen. So as a person known in the community, they came knocking in my door for asking for help. So I didn't hesitate to take their queries. But as time moved on, I saw that I'm seeing a number of people knocking in my door, and the timing was very bad because it was COVID time, and by then I didn't even understand what COVID was all about, and I was very scared of the disease because we were told that our age it's not good because if you're old, it attacks you easily. So what I did, because I've got community link with, I worked so much in the community, I asked people to the community, I spoke to them, I picked up relevant people to make a list for me to work with and to do a list of individuals who wants to be helped. Okay, then what was challenging is that I thought this was going to be easy for me to just do my applications and let go. But I found it, I went back to casework. It's so much of our work that you had to be done. It has to be done because what I did first, when you were doing the application, they will send you an OTP number, which is called application ID. You had to keep that number for each and every individual. Why we had to keep that number? Because what happened if the responses came back, they will give you OTP number so and so, and they just give you a surname. So if you don't have the OTP number next to the surname, you'd get confused whose response was. And another challenge was, if you use your cell number to load application, all the responses came back to you. So for me, it was an advantage using local structures to use their numbers, because when number responses came, they came directly to them, and it was easy for them to disseminate in the responses to the individuals, to beneficiaries. So I thought after that nightmare was gone, when number responses came to me, I thought that it's fine. But what happened, we had so many responses, and most of them were negative because people were declined by USASA. By then, they had a blanket reason for declining. They were saying, you currently have income from other sources, which was we couldn't understand what they mean. We have to, so I wrote to SASA and asked in their website, because they gave us the email address that you can send queries to. When I launch an application, remember you have to do each and every appeal one by one and ask for immediate. When I asked them firstly, what does this mean? No one responded to me. Then after that, I saw so many responses coming in: RIP5, identity verification failed, NSFAS registration, UIF registrations. So I had to work. I had to work with clients to help them. So the problem, if you would lodge an appeal, you have to do it one by one because of this individual responses. If it's RIP5, you have to send it through and say this client was rejected because of the RIP5. And the other challenge that people didn't have smartphones, because they didn't know that you have to use a smartphone. Even if they do have, they didn't have airtime. And even if they do have airtime, they didn't know how to use to go to come through the website because everything's written in English, so people couldn't follow the processes that you have to follow when having a query. So it was easy for me to help because those with data, it was easy. I used their phones and help them to apply, and the responses came directly to them instead of clogging my system, my phone. Okay, and what was another challenge was for me, my responses during the day, USASA was packed. You couldn't get through. You tried to lodge an application, it roamed around. So what I decided to do, I just worked overnight. During the day, I'll help individuals who come to my house or when that I meet on site and do applications. And I also teach some of the people like youth, especially when I went to the post office to say, this is how we do it, teach others in your area on how you lodge an application and how also to and also to do an appeal. That helped me a lot. And also, I had to work very late hours. And as I said, I thought it's going to be an easy thing. It wasn't easy because I had to see plus minus 400 beneficiaries. And after these beneficiaries, you have to have open an Excel in my system. So whenever I started lodging an application, I would put it through and say, lodge an application for this kind of person. Then after that, if the response comes back, you have to update and say whatever the status, because our status kept on changing. Today you have a status and declined NSFAS. The other day you have UIF. The other day you have identity verification. Okay, challenges when drawing the grant. The grant was a good thing, but they had challenges. I think government was not prepared for this thing, especially SASA and SAPO. They were not prepared. They didn't look at the capacities in SAPO branches. Most of the applicants, what they did, they had banking details, but to my not understanding, USASA decided to send them their payments to SAPO. And all my beneficiaries had only two options to choose from. It's either you choose SAPO or you choose the bank account. And both these paying sites didn't have sitting arrangements for my clients. What SAPO also has had a desktop challenge because most of the offices had only one desktop. I remember fighting for the Lamontville SAPO because we had so many clients coming through. It took me at least about 8 months for them to have an additional desktop, which was also not good. There were extremely long queues for beneficiaries to stand. And the reason beneficiaries were giving long dates, paid dates, but they were told that your grant isn't approved, but there were no dates. So people, once they saw that SMS coming through that your grant hasn't been approved, they rushed to the post office whilst the payments were not ready. And another challenge was for them. It took so long when monies got finished for G4X to deliver money. It took so long. And remember, some of these beneficiaries had to slip over for them to access USAPO. So it took them a long day. It took them. Some of them came as much as 4 o'clock, and for unsafety reasons in the township, you can't expect people to sleep over waiting for lenders and on the verandas waiting for the grant. What has been an impact on people who received the grant? The huge number of grant recipients, it was mainly youth and males. They used this grant to buy food and contributed towards their children, and very little was left for them to use. But they still managed to buy data and search for jobs. Some beneficiaries who were lucky enough, they had opportunity to start their small businesses, and they sell some stuff at the pay sites like cigarettes, airtime for people who don't have airtime. Okay. Did everyone who was due to receive the grant actually did receive the grant? No. There's a huge number of beneficiaries who had not received a grant since May 2010. And some have been paid as from May to October 2020. Some have been paid from May 2020 to January, but very few have received their grants in full. And most of the load is those people who did an appeals. Okay, do you think the grant has made a difference in the community? Yes, it made a huge difference. When we are monitor on OAP or OPG recipients or COCO on their day, they will tell me that this grant, who government has helped them so much, because now the younger ones, their children or their own children are contributing in their food. They also in basic needs. So COCO doesn't have to take care of everything. And it also opened job opportunities to local businesses who sell vegetables on the payday, because they had an extension, rather not to sell on the pension day, but also to be there daily to try their luck and sell. Okay, the current impact, the current arrest was a message to the government that people are hungry, jobless, and tired of being ignored. Also, empty promises made when government when political parties went to the communities, they promised them so much. And I also feel that COVID grant, we still don't have to stop to call for basic income support. The damage of infrastructures is going to be costly to COVID grant recipients, as beneficiaries will have to travel and queue, and the queues are going to be doubled compared to them. Like in here, I've just received a message yesterday from support that almost all post offices at Mlazi were damaged. And but they will try to fix them. I don't know when, but they say that they've started now. So I hope if they do it quickly, then it will be a good impact. But if they don't, so people have to come to Lamontville or travel to town, which is going to be very costly. SAPO has to come urgently with a backup plan to avoid delays and to avoid a delay. And then the last question that I've got, do you think there is a need to reinstate the COVID grant? Yes, I think there's a need. This grant has evaluated poverty in poor households, and the suspension of the grant has affected negatively on beneficiaries, as they cannot provide to their families now. That sense of ownership for a young male to come home carrying a bag of mini meal and giving to school and to contributing to the family has been taken away from them. And I feel that if it can be reinstated, people can benefit a lot. So just for interest sake, as the president announced yesterday that the grant is going to extend. I don't know how many calls I've received, how many people have come to my house asking when can they start doing applications. And it was also painful for those whose grants have not been paid, especially those who have appealed and no responses have come back. They are asking what's going to happen from us, because what has currently been happening, they've been no system on place. And because I've also tried so many times to try and do my appeals for them, it has been an appeal of an appeal, because what I can recommend SASA, their systems have been upgraded. So now, instead of doing one-on-one, starting to write an email, sending to SASA, when you go in the SASA website, you go in through to a marine statement, you punch that button, you put the ID number of a person and a phone number. They will give you, if it grant is still rejected, it will say application. Then you press the application, then it's an automatic application for e-lendos and e-appeal. So that's a good thing. But although they've closed that door for clients, and what they didn't even notice people that door has been closed, because people have been coming through and saying it's not working, and I had to tell them that no, guys, it has been closed. And again, the use of media, it helped me a lot, because I went to a media to announce appeals. Guys, the appeal is open. How do you do it? Which site do you go on? And some people benefited from that. Okay, I think that's all for now. And unless if people have got questions, thank you.
Wow. Thank you so much. How really insightful in terms of just the challenges that were completely part of that process. Thank you so much. can I hand over to our next panelist? I see there are questions, but we will come back. We will come back to the questions in a little bit. Can I hand over to the next panelist?
Thank you, Rachel. I believe that's me. Welcome, everyone. Thank you so much for joining us today. I am going to be starting us off on the report that the three researchers who worked on it prepared. That's myself, Erin, and Agnes. So we're going to be presenting this report, which was commissioned by and led by the Black Sash, on social protection in a time of COVID, lessons for basic income support. And what we've tried to do with the report is to essentially consolidate lessons from successful and unsuccessful applicants, perspectives on the COVID-19 SRD grant and mobilizations on the basic income support. And so as a background, sorry, I forgot to share my screen.
And that's okay.
Thank you. I hope you can all see the screen now.
Yes, we can. Yes, we can. Thank you.
Thank you. As Erin will take over to speak on the systemic factors, I'll return again to speak on the social impact, and Agnes will close for us with recommendations. So in talking about how this work came about and the methodology and objectives of the project, I think it's important for us to first acknowledge that this work continues and builds on work that started a long time ago. I think Rachel made some reference to this. The Black Sash and other civil society organizations and social movements have been taking the government to task for many years since the late 90s, pushing for a comprehensive social security system in South Africa that does not leave anyone out. And so this work is a contribution towards that goal. And what happened with this project is that when COVID-19 started last year, the Black Sash monitored the application and distribution process and worked with partners such as the Community Advice Office and the Social Change Assistance Trust. And so the monitoring happened, and then as part of the research aspect of that project, we came in then and we interviewed in total 23 government officials, NDA volunteers, community monitors, as well as Scalabrini staff. Scalabrini is an organization that provides help and assistance to asylum seekers and special permit holders and refugees. And then we also conducted 26 interviews with successful and unsuccessful applicants of the COVID-19 SRD grant, caregivers who were receiving the the caregivers grant, as well as asylum seekers and special permit holders. For the applicants, we conducted interviews 3 times for each person over the phone. Due to the pandemic, we couldn't do them in person. And the project ran from August to December 2020. So our hope was that we would be able to walk alongside these applicants from application through to receipt, as well as be able to get a sense of how the grant was then received in the household, what impact it was having and on the individual. And the aim all along has continued to be to use these findings and the research project to build a case for the introduction of basic income support. And so then as a bit of context, which Rachel already provided very well, we know that COVID-19 started, came last year when it happened. It changed all our worlds, turned the whole world upside down. And as Rachel mentioned, in the context of South Africa, it arrived in a context where already we had exceptionally high unemployment levels, where people were already grappling with poverty and just living very. And so the pandemic coming onto that context, had a devastating impact. We've seen the needs cram waves, with the latest one showing that the worst impact has been on women who've not been able to return back to work, many of them, as casual workers who've also been most impacted. We've seen that rates of hunger and food insecurity, which were already high, have just continued to soar during the pandemic. And attendant impact on mental health because of the increased precarity and so when the government introduced the social relief package, it was coming into a context of where it was urgently needed. And so the social relief package became a type of vaccine before the actual vaccine. And so the social relief package introduced new grants, namely the COVID-19 SRD grant, the caregivers grant, and then there was also a top-up of all grants, including the CSG. And so what it did was to, after all these years of trying to get the government to cater for low income, those with little or no income, and certainly those who are unemployed. What COVID-19, amidst the devastation, what it did though, which was remarkable, was to open up this opportunity for South Africa, where for the first time, the age cohort, of people 18 to 59 years old, were for the first time ever, included in the South African social security system, and for the first time felt recognized by the state. As this participant from KZN told us, in the beginning of lockdown, it was very difficult because a person was unable to look for jobs. It was difficult because we didn't know what we would eat before going to bed. It was difficult because we were sitting around doing nothing with nothing to do. Everyone was looking at each other, because usually when you leave to look for a job, they knew that you would come with something, but now it's been very difficult. So this participant was talking to just the hard impact of the lockdown. I will now hand over to Erin, who will speak on the systemic factors. Okay, I'll try and run this for you, Erin.
Thanks, Wanga. You can change the slide again. Okay, so as welcome as the COVID grant was, and certainly as welcome as the president's announcement that it would be reinstated is, when we interviewed applicants and community monitors, what we found over and over again was that the system, the application and distribution system, made it hard for people to really access that money. And in some ways, the press covered a ton of people who were getting grants that they shouldn't have gotten. That was a common story. But what wasn't as much covered was the people who should have gotten grants but weren't getting them. And those are the people that we interviewed more and more in our in this research. And so the initial exclusions for this grant was that, as Nellie had talked about 1/3 of applicants were excluded just on their first application. So for the current reinstatement of the SRD and for any future basic income support, it's really necessary to capture the learnings about these systemic exclusions. So that's what I'll go through real quickly right now. Okay, you can advance the slide. Thanks. So the exclusion started with the budget allocations, which by any calculation were austere. So President Ramaphosa initially announced a 500 billion Rand relief package, of which 41 billion was designated for social grants. But 29 billion of that was for existing grants that were topped up. So that meant that only 13 billion was available for a new COVID-19 SRD grant. So in our interviews with officials, government officials, we heard that SASA calculated this and knew they could only cover about 6 million people at 350 Rand per month for 6 months within that allocation. And yet there were 10.4 million people potentially eligible because of their unemployment status. So this underfunding actually was set up, the way the system was set up excluded people from the get-go. Okay, next slide, Wanga. Thanks. So in one of our interviews, a government official told us the key reason for the stringent regulations was this thing about how much money we had. This 18 to 59 group, we didn't have a sense of what sort of income levels they had been at or what other means of survival they had. And we had a really small budget in which we had to fit the most vulnerable people. In fact, we found that if you put it at the food poverty line at 580, you would exhaust your budget. The number of people below that poverty line was above the allocation that we had. So basically, this official was telling us from the start, they had to introduce stringent verification procedures to take that 10.4 million people that were potentially eligible and ensure only 6 million of them actually got the grant. So that was a massive exclusion just based on the budget allocation. Now, after the reinstatement of the SRD was announced on Sunday night, what we first don't know when it will be reintroduced yet. So as months pass, of course, the budget that's needed shrinks, but also no budget has been announced yet. So this is something we need to watch out for as civil society and journalists to see what is the budget? Is it enough to cover all those people who need it? Now, the exclusions have been well covered. So caregivers were excluded because they already received CSGs. Children were excluded because their grants were only topped up for 1 month. Asylum seekers and special permit holders were excluded up until the Scalabrini lawsuit. And even after that, it took another few months to create a new system where their IDs could be verified. So none of them received any money really before 2021. But the exclusions I want to focus on here are really the systemic exclusions of the application and distribution system, so that when everybody now has to re-register, we know how to make some of the problems, ameliorate some of the problems that we had the first time. Okay, go ahead and switch the slide. So the application system was set up into 4 parts. People could register by USSD platform, which was run by Vodacom. And the vast majority of people, over 80%, used this platform. It was free or nearly free to users, but it led to many incomplete applications because people couldn't input their data within the short timeframes the USSD platform gives. Then there was the WhatsApp platform, which was run by GovChat. This got lots of press, of course, because GovChat did this, designed this service for free. Only 12.5% of applicants used the GovChat service. It was not free, they needed data, and lots of the applications that came through the WhatsApp platform were also incomplete because people ran out of data before they completed the application process. People could also register through SASA's website and email platforms, which were run by ProSense, which manages SASA's biometrics, and even less people, less than 10%, used both of these platforms. There was no face-to-face registration option because of COVID. Now, when everybody is re-registering, as Minister Zulu announced yesterday, for the reinstatement of the COVID-19 grant, it seems as if, from what's been stated in the press, the USSD platform may no longer be available and that people will be routed to the WhatsApp and website and email platforms. Now that's potentially a concern because, again, less than 20% of all applicants used those platforms the first time because they were expensive. Okay, you can forward the slide. So the application challenges, I won't spend much time on these things because Nellie perfectly detailed them. People struggled because they couldn't reach a SASA office and apply in person. The digital platforms were in English. People needed airtime or data to apply using most of the platforms. People didn't have the technical savvy to necessarily get all the data entered in the right way on the first try and got thrown out of the system if it didn't match. Some people didn't understand the SMSs they were getting in response, other data that was requested or paydays. And ostensibly, this grant was for people earning no income. In fact, all over you had to prove that you had no income in order to get this grant. But people had to spend money in order to get it. Even to get money to apply, people had to spend money. So this led to a lot of borrowing, which was very debilitating for people. Many folks that we interviewed mentioned that they had to borrow money from family and neighbors just to apply for the grant. Next slide. So a community monitor from KZN told us that, I can tell you on the first day, the line was hilarious, but it wasn't actually funny. 200 people. It shows us most of the people, the level of unemployment in our communities. And believe you me, most of them were males. 70% of people I was assisting were males. And it shows you the level of our poverty in our community. It's too bad. Though she called it hilarious, she went on to explain why this line wasn't funny at all. And she also told us how it wasn't just the first day or the first week that this line was long. In fact, the same people came back every day to follow up on whether or not their grant had been approved, what sort of communications they were getting from SASA, and what payment days they would be paid on. So without the support of community monitors from SCAT and CAWUSA and the Black Sash and many partner organizations, even less people would have gotten this grant. Recipient numbers would have been much smaller. Okay, next slide. And of course, since the rule was to receive this grant, 18 to 59-year-olds had to have no income. This was a very regressive means test. In fact, the most possible regressive means test that could have been introduced. And instead of this being like another grant where an applicant would bring proof of their income using their bank statements to a SASA office, SASA checked eligibility against these other government databases. Now, this was, of course, important because it was a pandemic and this protected people from transmitting the virus. But most of these databases had errors and were very out of date. So the vast majority of people who were rejected from this grant were rejected because of these database checks. Now, when people like Nellie and others tried to help folks appeal, the appeal process was processed against these very same databases. So you were rejected the first time and the second time, essentially on the same basis. There was almost no ability to submit supporting documentation to challenge the information in any one of these databases. So that could happen in slim, narrow ways when a community monitor like Nellie knew the SASA official and could bring an affidavit with a client saying, actually, this person has not been working over the past 3 years, despite them having a file or a IRP5 registered at SARS. So that wasn't a recourse system that was available to everybody. It was a recourse system only available to some. Next slide. So a community monitor, Andiswa from KZN, all these names are anonymized, by the way, told us, I would phone the SARS call center only to be told, you are number 280 or something. I would wait and wait until my airtime runs out. I knew my airtime was going to run out, but I would wait because this client had faith in me. In one case, when Andiswa did get through to SARS, she learned that her client had had a temporary position as an independent electoral commission worker years before. After that position, her client never had another formal job. But when Andiswa traced the IRP5 form, she found out, as she said, there's R1.80 in that form, that's it. So her client was rejected from the COVID-19 SRD grant because of some, I don't know, evidence artifact in this database of R1.80. So the SARS database was so out of date that it did stop being used at some point, but UIF, NASFAS, SOCPEN all kept being used. SOCPEN, of course, is SASA's legacy database, and that was what was used to reject caregivers because they would have already been registered in that database as child support grant recipients. So yesterday, Minister Zulu was talking on ENCA about the need for, in her words, sorting out who deserves this grant, who has no income, and who is undeserving. And she said that these same systems will be used. She also said that these systems have now been improved. But this is another thing to watch. What are these improvements? We didn't hear any details about what these improvements were. And certainly on the basis of our past experience, we know that these databases are terribly problematic. Okay, next slide. And finally, the distribution system. There were all sorts of exclusions through the way the money was distributed. Most people were paid at the post office. Money was inconsistently delivered and insufficient at post offices. We interviewed many people, particularly in rural areas, who would sleep overnight to be the first in the queue because they were so afraid that the post office would be short of money. Others had to travel long distances or make multiple trips because of cash flow problems. This is injurious to people's dignity, the size of these queues. It was not an efficient system. The solution was that people could move to their banking systems and input their banking details. But the application platforms sometimes struggled with the inputting of the bank details. So we talked to people who would go to the bank thinking that they had inputted their bank details, only to find out their money wasn't there and then have to go to the post office instead. Bank charges on grants were initially deferred, but at some point they stopped being deferred. And so any bank charge would again take value from the grant. Additionally, SASA checked people's bank accounts, at least at the beginning, every month to ensure there was no other source of income, to confirm that people didn't have any other means. And SASA could stop the grant for that month if a person had other money coming in their account. So we met people who may have gotten a very small remittance, 100 Rand from a family member, and that was the grounds enough for stopping a 350 Rand grant. This was completely counter to the purpose of the grant. The grant was, as we know, set below the food poverty line. So if people didn't pool resources or send remittances or try other hustles or get money in some other way, they actually would not have been able to afford to live. And yet any money that they did make on the side was used as reason to stop the 350 Rand grant. This standard of no means cannot be abided in any new system. Next slide. So as one of our monitors from KZN, Sizwe, said, 350 Rand is nothing for me. If you are going 3 days to the post office, you have utilized 200 or 250 Rand already. So Sizwe was from KZN, and the post office in both Howick and Maryville did not have post bank facilities. So residents from Maryville were sent to Howick, and then from Howick to Pietermaritzburg. At Pietermaritzburg, the staff asked, and I quote, "Why are you coming to congest us here? You're causing pandemonium," end quote. So people would have to make 3 or 4 trips, multiple days in a row in order to get their grants. This is a catch-22. It's particularly insidious with the no means test. If SASA was checking you had no income in order to access the grant, but you actually needed some sort of income in order to access the grant. So this is something that we need to watch. Nobody should have to pay money in order to get their social entitlement. So to sum up, one of our monitors from Gauteng put it this way: this was a strategy to save government money. All of these sorts of exclusions within the application and distribution systems, within the initial budget allocations, were about making sure that the number of people fit within the budget that was available. As the SRD is reintroduced and expanded, we need to watch this closely. Thank you very much. Wanga, back to you.
Thank you, Erin. So I'm going to be presenting on the social impact. My slides are not moving. Can you, Erin, can you help me from your end if you have the presentation up? I'll stop sharing. It's not working.
Sure, let me see if I can get it up. Ernst, actually, could you, there we go. Ernst is gonna share it, hopefully.
Thank you. Okay, we go to the social impact slide, Ernest, thank you. So I'm going to be presenting the findings from, mainly from interviews with those applicants who actually managed to get their grant, who were successful in getting the COVID-19 SRD grant. And so these interviews pertain to their experiences of having the grant, whether it impacted on, it made any difference, its adequacy levels within their lives and their households. Next slide, Ernest. And so at the psychological impact level, certainly all the recipients of the COVID-19 grant, all the applicants we spoke to were very grateful for it. For the first time, many of them, especially those who'd been unemployed for a very long period of time, some had been unemployed for 15 years, 20 years. For the first time, they felt seen and cared for by the state. And for others, it restored their dignity and position in their families, in their households. Next slide. As this Western Cape grant recipient told us, it did help me because for the first time at my house, they were depending on that money from me to put food on the table. So for this participant specifically, the other members of their household who'd been working lost their jobs because of the pandemic and couldn't apply for the SRD grant or were unsuccessful. And so she ended up being the only person in the household who was getting some form of money. So for the first time, after being unemployed for 15 years, this household, her household, looking up to her now. And so that restored her sense of place and dignity within the family. Next slide. And so the sort of what the impact of not then receiving the grant was when contrasting it with people who were able to receive it was particularly obvious. And referring to the slides that to the presentation that Erin gave on how rejections of the applicant were often did not make any kind of sense to the applicants. And where they did, they were erroneous, for instance, people being found on databases that they shouldn't be on. And so this had a huge impact because for many of these applicants, this source was their only hope. So to have that hope dashed brought on a lot of distress for a lot of participants. And it also complicated relationships, especially in contexts where one person would get rejected whilst their friends or neighbors or even family members within the household would get accepted. And yet it wouldn't be clear why they were rejected while others were accepted. So it brought in, introduced a lot of tension and complicated relationships within households and the community. We also heard from the monitors increased reporting of gender-based violence in households because of just the pressure from not having any lockdown, as well as from being rejected. Then at the material level, the COVID-19 SRD grant, because it was so small at 350 Rand, it was mainly used for basic needs. It was also used to access basic services, which should have been free for those low-income recipients. What we found particularly jarring about the findings on the spending of the COVID-19 SRD grant, which was already so small, was how in some households, the entire amount went to services, especially water and electricity. And so, you know, recipients who waited, many of them for months to get the grant, then to finally get it, and it's already a small amount of money, and then having to use all of it to pay for services that they should have had for free, was devastating. Next slide. This grant and Cape, that 350, it's not that much, but it is helping there and there. We can buy bread and electricity. It's just for the basics, illustrating the point I've just made. And next slide. Then this a community monitor in Northwest, where that rural area had no water whatsoever. This was an example. This quote is an example of those instances where the entire amount went towards paying for water. As this community monitor told us, there's no water here, buy water, not from the supermarket, but from those ones with the boreholes. You say 1,000 liters is 350 Rand, so you have 350 Rand. Next slide, please. And so really the COVID-19 SRD grant was really small, and the only difference it could make was to move, say, participants from someone, you know, a successful applicant, from eating 1 meal a day to now having 2 meals a day. It could much more than that. And in many households, in fact, we were told that it ran out within a few days. In one household, one participant told us that it ran out within 2 days. And another participant in the Eastern Cape told us that if the COVID-19 SRD grant was all that he had to depend on, within a few days he would have absolutely nothing. He would have no money. So I think this also then brings home the point that Erin made about how this amount was so small, and yet the stringent measures that were put in place to exclude people, which, you know, would penalize applicants for having even the smallest amount of money in their bank accounts, as though the grant was actually enough to meet their needs, was frankly just you know, difficult to understand. And so the inadequacy of the grant, what it also did was that because it couldn't meet even the most basic food requirements of recipients, it meant that they had to continue to be reliant on their reciprocity networks. And yet those networks were severely decimated and diminished by COVID-19 because most people lost their jobs. And so having to rely on people who themselves didn't have much anymore placed recipients in very difficult positions. One participant in the Eastern Cape told us that people now shorten their hands, which means so depended on before for help in that particular household. Those relatives were now shortening their hands. They were not. Next slide. And so even though every single participant we spoke to was very grateful for the grant, they were all very clear that it was not adequate to meet their needs. And they called for its increase. And interestingly enough, the amounts that were mentioned range between 500 and 1,000 Rand, which was interesting because those participants were speaking from their own intuitive sense of what could be adequate or closer to adequate. And yet those amounts are actually, you can link them to objective measures of need that we already have in place, such as the 500 Rand, which is closer to the 585 food poverty line, and the 1,000 Rand, which is closer to the upper bound poverty line. And so intuitively able to see where the amount, where it should be pegged to get it to be a bit closer to being adequate. Next slide. This participant in Gauteng said, I would appreciate it if the COVID grant were to be permanent and increased to 500. The 350 is too little, even though it does help. I wish it could be permanent. So this participant was talking about both the need to increase it to some level that could start to approach adequacy, but also about how it needs to be permanent. Next slide. Another one said in the Eastern Cape, all the unemployed people can get a maximum grant of 1,000 Rand or more. It can be better for all citizens of South Africa. So I think those who've received the COVID-19 SRD grant, they have spoken loudly and clearly about what government can do in terms of this grant, and any measure that works towards a basic, towards basic income support going forward in terms of the adequacy thresholds as well as the permanence. I'll now hand over to Engenas, who will bring us the recommendations. Thank you.
Thanks, Wanga. Next slide, Ernest. So yeah, I mean, and taking over from that participant and many more who said they wish the grant could be made permanent. That's where we are at the moment. While we welcome the president's, the president's announcements that the grant has been extended until March next year, it is our wish and recommendation that the grant also be made permanent for those old age 15 to 59 with little or no income. And this is a first step towards the universal basic income as a country. The amount should be linked to an objective measure, and that objective measure is poverty lines in SA. So we'll start off with the lower bound of food poverty line, move up to the upper one, upper bound poverty line eventually. And in addition to the BIS, there shouldn't be a negotiation around whether we should scrap any other grants. Those should still remain, and the BIS should be an addition to the grants that are already existing in the country, and including the child support, elderly grant, and other services should also be made available, or their efficiency increase in terms of delivery to the people, including free healthcare, education, school nutrition programs, and water access. As we know, it doesn't help much if you provide people with the necessary income, but at the same time, they still have to utilize those amounts to get their free basic services, which they should be getting for free, but instead they use it utilizing those amounts to spend it on those. Next slide, Ernest. So yeah, and some core principles we would like for the basic income grant is that any means test, any future means test for the 18 to 59 should be pegged to the same amount threshold, at the very least, which is the child support grant, which is 10 times the amount, the grant value, that is the child support grant. So whatever it is for us, whether it's 500, it should be 10 times as a means test for a start, which would mean that anybody earning less than 5,000 would be eligible for that amount. A zero means test, as we've seen through this trial run, if you can call it that, for the SRD COVID grant, simply excludes too many applicants who should qualify. And all unemployed adults, and not only unemployed, but would call it a low income grant to that extent, including caregivers who receive the CSG on behalf of children, should be eligible for any future BIS. and as well as extended to all refugees, asylum seekers, special permit holders should be eligible for the grant as well. And the application process should be streamlined to what your ordinarily South African citizen would be eligible for. Next slide, Ernest. And the second biggest recommendation that we're making is to also increase the CSG amount and to increase it to the food poverty line at the very least, or as a start. And so this is in addition to the BIS and not at all or either option. So we choose the BIS, but also in addition to that, we realize that the CSG reaches at least 5.7 million households, and for them and their families, and it does provide significant impact, as we've seen throughout the studies and MDS. And what we ultimately say is the CSGS and the BIS should be at the ultimately be at the upper bound poverty line, but for as a starting point should be at the food poverty line. And as the years go by and as the economic situation of the country improves, we can then allow ourselves to increase the amounts accordingly as well. Next slide, Ernest. And third recommendations, which is a number of systemic changes that should be happening, especially now that we've seen that the SRD COVID grant has been extended up till March next year. The first one is all government databases must be up to date for them to be a reliable source of verification. As Aaron said, you use SARS, you use UIF, and simply those databases have been outdated or have resulted in people who should be eligible being kicked out of the system. And as a recommendation, we're saying those should be updated. Applicants and recipients must be able to access both digital and face-to-face services from SASSA. And I think with while it was happening with the leveling down of lockdown levels, that some SASSA offices had started to open, but since we've gone back to level 4 and level 3 at this stage, what we're saying is SASSA must just find a way to enable those who are unable to access digital access to have face-to-face platforms as well. And all digital application platform must be free, meaning that those eligible should not carry any data or airtime cost to apply for the grant. SASSA must have a proper system in place for cash payments, which should include more options than the post bank. We've seen many challenges with the post office as it is. And what we're saying is that rather than have that as a once-off option, as the only solution for cash, they should be exploring other options as well for cash payments to recipients, especially in rural areas and urban areas. Next slide, Ernest. And also all distribution sites must have regular, reliable, and sufficient cash flow. And we cannot stress this enough. We've seen it in our studies as well. People go there and they're being told there's no cash or the cash has run out, or staff has been reduced as a resulting in long queues. And we're saying these are admin issues that should be resolved. In fact, it's one of the low-hanging fruits that should be resolved by SASSA, if not done so, or if not working towards it already. Recipients who receive their money through the banking system should not pay any bank charges to withdraw their grants. It's a recommendation. And also SASSA must have an effective information communication recourse and appeal system. So it simply doesn't help that you've been rejected and you don't have any communication from SASSA as to why you've been rejected. And the recourse system as it was then, the time of writing this report was also not sufficient or explanatory enough to allow for beneficiaries to come back and say, here's additional evidence that I've gathered. You've said this is the reason why you've rejected, but I have proof of the otherwise. That wasn't allowed, and we are saying that's simply wrong, and it should be allowed. And once an application system has been approved, there should be no monthly verification. And yeah, it just places an administratively burden on SASSA itself, and that's why some of the things could be falling as a result of this. So we are saying once you have been approved for the grant, if it's up to next year 2020, then let it be so. There shouldn't be a monthly verification to say whether you still qualify 2 months later down the line. Yeah, and next slide, Ernest. So in summary, what we're saying, So I just hide this. What we're saying is that one, the basic income, so there should be a basic income support for all those 18 to 59 at the food poverty line of 585, and also increase the CSG amount to the 585 with an ultimate view of increasing it, both grants to the upper bound poverty line as soon as possible, both to be means tested at 10 times the value of the grant, moving towards universalization. So at 10 times the amount at the food poverty line would be 5,885, which means that anybody earning below that would basically qualify for the grant. And that's becoming a low income grant. And there should be no exclusions for BIS, all 1880 to 59-year-olds, including caregivers, for CSGs, refugees, asylum seekers, special permit holders, and should be able to qualify for the grant. And this should be in addition to a broader social safety net, and it shouldn't be an either or. So we either introduce this, but we have to cancel this grant. We are saying the current grants or social assistance program should remain, but this BIS should be an addition to that system. The application and distribution system should be free, easy to access, and have effective automated face-to-face options, including for recourse and appeals. And that's just speaking to the whole administration of the grant itself, especially now that it's been extended to March 22. And I think that's the core summary of the report and the recommendations from our side. And I'll hand over to Rachel, I think. Thank you, guys.
Wow, thank you so much. Thank you so much, Nelisiwe, Agnes, Dr. Aaron, Dr. Wanga. What a great just picture of everything that went into this, and the outcomes that and the challenges that were faced as we were going through this. So thank you so much. I'd like to take this opportunity now to, I see that on the chat they've shared the link to the report. So if you do want to go in depth, if you want to go into more details, please use the link, go through it, and we'll be able to engage on that at some stage. But right now, I'd like to open up the floor for questions and answers. As I mentioned earlier, I had asked that if you could please use the Q&A function in order to ask your questions, and I'd communicated to everyone that I'll be reading the questions out, and then the panelists can decide who, unless if you were the asker of the question and you wanted a particular person to answer it, so please feel free to just jump in. So perhaps before we do that, let me just start with the first one. Agnes says, thank you very much for the presentation, very important. Do we know the prevalence of grant recipients? Who are the people not receiving the grants? I'm happy for either of the panelists to just jump in. Perhaps,
Sure.
Nelisiwe, you were on the ground, or who is not receiving the grants, essentially?
I think there's no specific who's not receiving a grant, but it depends on what the system finds on you, because when you lodge an application, as I've said before, they will give you a reason. It's either they approve it or they don't approve it. So those who are not receiving, some of them have been approved, but because there are no pay dates, USAS are still verifying the amounts and whatever, they don't receive grants. So and some of them have did appeals, and they're still waiting, and it depends on what SASSA is saying. They are not receiving a grant, but there are so many people who are still awaiting grant applications, because some of them, they don't even have responses. If you have the guy to go online and check what's the problem, there's nothing, it's quiet. So those are the kind of people that we are sitting with.
So you would say it's essentially a mix. Yeah,
I'll say that it's a mix.
Okay, great, thank you. I'd also like to apologize. For some reason, whenever I open my Q&A tab, I seem to disappear from your screen, but I'll be back shortly. The second question, Sabelo asks, what is the recourse for approved beneficiaries but who did not receive their grants at all? Who have appealed but their appeals ended in a fiasco? So essentially, for the applicant that got a yes, but then ultimately didn't receive the cash. What are the recourses there? Can I hand that over to someone else?
Yeah, sure, I can take that. I
Thank
mean,
you.
yeah, what we've seen is, and that's one of the recommendations for SASSA to simply fix that recourse and appeals mechanism, because it's simply not functional at all. They've put it in place to the point where a beneficiary, but how I view it is that no beneficiary can bring evidence, even if you appeal and you success, there's simply no communication to the beneficiary at all. And what it says that simply needs to be streamlined. It is somehow different to your normal grant application appeals processes, which is more transparent and more open to the public. So you can go there, present your case, and you get feedback and all the step of the way. But with this one, because maybe they thought it's a short grant, they could somehow sideline that process. But what we're saying, because especially it's been extended for such a extended period than it originally was, over 6 months, it should be part of the bigger appeals process, and it should be streamlined. And the budget issue, I suspect that the budget issue might have been one of the key reasons that have to keep people away. Sasa, I think if they're here, then they can respond to that. But yeah, in addition to that, I just think it needs to be part of the bigger process. And yeah, Sabelo, you're absolutely right. And that's one of the engagements that needs to happen with SAS at this stage. We've realized that, and we're engaging with it. They have promised that they will start fixing it, but they've provided alternative reasons why it might not. But we're simply saying that's not good enough, and hopefully we'll get it right this time around.
Absolutely, thank you. And just the third question from Andres, it says, is there a scope to campaign for an increase in the availability of free basic services? So he's talking about water, electricity, maybe transport, to accompany the rollout of the social grants. So would there be merit in trying to calculate the level of a more equitable social wage? So essentially, are we able to sort of calculate what things generally cost if we get more basic services, and then we're able to get to an amount that is sort of sufficient? Or is that a futile exercise?
Sure, I can go in again. I mean, personally, I don't think that works as well. Because it's simply taking away responsibility from government, who should be providing these services. So I would say we'd rather lobby for the delivery of those services effectively, and to the point where whether it's municipalities or local government can effectively deliver those services, so that the grant is stretched to the point where it is. The other way to do it would be to say, right, you are not effectively delivering water and all these other services. I'm going to take that budget away and give it into the people's hands. But the problem is that you're moving towards privatization, which might be able to deliver those services, but then they might end up being more expensive than what they are, and therefore, leaving you in a worse of positions. So ideally, taxes should be used to the point where government should be effective and efficient enough to deliver those services to the poor, to the point that you don't have to utilize your own monies to, access those services. So I would say rather account to whoever is your municipality, or, councillors, ward councillors, or even holding holding your own political parties to account for the non-delivery of those services. And
Absolutely.
yeah.
Absolutely. Thank you. I just wanted to, before I continue, I see Salwan has his hand up. Salwan, would you like to go? I think you can just unmute yourself.
All right. Can you hear me?
Yes, I can.
Good afternoon,
Please go ahead.
everyone. everyone. Thanks for a very interesting conversation. Part of a perspective of the system that one hardly ever gets to, and that is to see what really happens on the ground. So thanks to the team who has done the research. Still trying to figure out whether this has been documented, but I'm sure I'll be able to follow up with you. There was a question around whether one is able or whether we can cost what should be provided to people. And I hope I understood the question correctly. But the Financial and Fiscal Commission has been doing these types of exercises on an ongoing basis, and we're not making sufficiently use of their knowledge base. In 1999, I was still employed there. We developed what was called the costed norms approach. And there was a whole debate around it. But one of the things we achieved, which was easier in social grants, was to say how much money government was supposed to give to provinces. That really changed what we then had as a formula, which was inconsistent with the law. So we were able to say, and you'll check the numbers from 2000 to 2003, the social grant numbers grew very fast because it was much more explicit. The debate then was, can we cost how much water people should be getting and how much of free basic services? Yes, that was costed too, but it's a lot more complicated than a tangible amount. And so I'll do what economists do and say, all things being equal, forget that you and I have different sizes, eat different amounts of food, but on average, the Medical Research Council has calculated how much food the average person needs, how much water, etc., etc. What we do know that there is a big gap or deficit between what is needed in the country and what government is able to support. So yes, we can say, and this is what you're doing very well in this campaign, is to say, we want a basic income grant at a minimum level of 550 plus minus. That's very explicit. And in a similar way, we can say how much water and everything the average person should be getting. I hope that cleared up the question. And you're doing excellent, this gap between what was given by Treasury for this COVID relief compared to the demand out there is a big issue, and it was never made as public as you are making it. So keep on with the good work, and thank you, all of you. Cheers.
Thank you so much. Thank you. Alexa. Alexa, we can't hear you. Okay, while Alexa gets her things working. Nomboniso, would you like to go? I see your hand is raised. We can't hear you, so I'm not sure if you're on mute. But while the people that had hands up get their mics sorted or whatever it be, in the chat, someone asks, Dr. Wanga, someone asks, what level of accountability is needed in the wake of the way grants have been so badly managed?
I think, first of all, as the particularly Erin's section of the obstacles that were put in place were intentional. The thing that would need to happen is to remove the deliberate exclusionary measures that were put in place, which created the obstacles. So getting people to jump through so many hoops to get the grant was put in place to ensure that as few people as possible would get it. So I think with the pronouncements made by Minister Lindiwe yesterday, we can expect and we can call on the department about what do they mean by there have been improvements in the system. And we need to know what those improvements are, and we need to then, input on whether those, but also the budget needs to be sufficient so that the department is not left with the task of having to figure out how to ensure that as few people access it as possible. Thanks.
Absolutely. No, that is really true. Dr. Erin, I don't know if I can throw this one to you, but it says, Chantal asks, given that the 350 is insufficient and that the food distribution networks were so stressed, what were the other coping mechanisms that households were engaged in to meet their basic needs? So what were their other sources of support?
Thanks, Rachel. Certainly I can speak for the interviews that I did, but then I think I'll throw it to Wanga because she did more interviews with beneficiaries than I did. But some of the strategies that I kept running into were debt. People were either borrowing money from family members or neighbors or even money lenders to get through this time. Even after they were receiving the grant, one young man from the Free State told me he got his grant, it immediately had to go to pay for electricity, and then he used the fact that he was receiving a grant to go to the money lender to lend more to buy food for the month. So because he was the same person who told us that, family members had shortened their hands because everybody was so stressed during this time, and the typical reciprocity networks that had been available were not. Wanga, do you want to add anything there?
No, I would say chiefly those are the mechanisms. Community-based, sources of support that were put in place that were inadequate simply because of the sheer demand for those services. So people relied a lot on food parcels, those who could get them. People relied a lot on soup kitchens, those who could access them again. And then interestingly, there was a case where people deliberately pretended to be sex workers so that they could access food parcels and help from NGO. I thought that was just one of the most using their agency and creativity to try and access food.
Sure.
Okay, Rachel, can I come through?
Sure, of course.
Okay, what was happening currently here in KZN? I'm not sure if other provinces had the same thing. What was happening? SRD food vouchers from DSD, they were moving out. It was 1,350, which was a very sufficient amount to help to top up on the SRD grant. But the challenge was that as Uwanga was saying, if you could get it, because it was distributed via my councillors, and it was hectic. I was part of the people that were assisting. I was trying to assist, especially those who were waiting for my appeals. It has to via my councillor. My councillor, as long as if you are not in their camp, you'll never get it. And if you are not on the same political party, you'll never get it. So I had to hustle very hard to make sure that my people who are on my list get those parcels. And thanks to the provincial, the district manager of DSD here in KZN, who was very helpful, who had to write to those local office managers and say, please acknowledge your Black Sash. They're here to help. And acknowledge your people, because you will find that sometimes I have to go and sit on site and make sure that the people that I've referred, they're not they do receive their food vouchers. Because what they will do, what I did, I sent through my emails to each and every local DSD manager and explain this person is unemployed, awaiting the SRD I've assisted in lodging the appeal. And when a person comes in, depends, the attitude of the manager. Some of them will give the food vouchers, but some of them will not. So some of them I had to go, like I said, I had to go and sit there and say, but guys, these people are hungry. These people are waiting for malinders and food vouchers. And because of this, the system didn't talk to SASSA system. They couldn't see that these guys have been waiting for so long for their SRD grant. Thank you.
Absolutely. Wow, thank you so much for that. I want to be respectful of everyone's time, and I see that we still got quite a lot of questions. So can I ask that the questions will be answered in writing, so that we're able to end on time, as I'm sure people have other commitments and we don't want to hold you too long. But just to focus on the point that Sis Nelisiwe was saying, I just want to emphasize and highlight the importance and thank the particular contribution of the paralegals of Black Sash through this process. Because as you can hear, it's not just your sort of office work where you sit in an office and do it far. It's sometimes a direct hand holding where you have to go sit with the client, go through the process with them as if it was yourself. So I would like to take this moment to just acknowledge all the paralegals across all the provinces we work in and thank them particularly for their contribution towards this research. Just lastly, I saw someone ask, is this research concluded, and can it be used as a case study? So could I just send that off to whoever is ready? Because I think the person would like to be in contact, but yes, you can be in contact with us with regards to that and what aspects you would like help with that. So thank you so much. We will have the panelists answer the questions in the chat. So please don't hesitate to do that. But before I conclude with my thank yous, I'd like to hand over to Teresa quickly, and then we'll go. Teresa.
Thank you so much, Rachel. Just to give input around the status of this research. Yes, the research report is in the public domain, and we would be very grateful if people used it and shared it as widely as possible. We do have plans in place to monitor and to do further research into the COVID grant moving forward, and we will share information about that as we begin those activities.
Absolutely. Thank you for that. I'd like to take this moment. Thank you so much, Aisley, for sharing the link for people to be able to download it. I'd like to take this moment to just issue special thanks to a few people who have contributed tremendously to this work. I want to caveat that by saying that a lot of people participated in putting this work together. And so forgive me if I'm going to skip one or two people, but firstly, our panelists, thank you so much for the time, the resources, the energy that went into putting not only this presentation together, but the entire research together. We are really, really grateful. And I think, as someone has said in the comment section, that it's quite an important piece to have in the public domain because no one else has something quite similar to it. We'd also like to thank GroundUp for the use of their images. Thank you for that. We'd also like to thank Ernest, who ran our text today. It was really smooth. As we know, technology is not always the smoothest thing to do. So thank you for managing that very well. We'd also like to thank all the research participants, people that took part in this research, even if they didn't know or if they did know that this feedback session is happening. We'd like to thank all of them. I'd also like to particularly thank the former Black Sash director, Lynette Mart. Lynette, thank you for holding the space and for starting this process and for just being passionate about this kind of work and holding it then. So thank you, Lynette, for your contributions towards it. The Black Sash team behind the scenes, incredible. Esli, Huda, Teresa, a lot of people really held this space in order to make sure that this launch happened. I really just want to thank you and our paralegals as well for all that you have done. to make sure that this ran smoothly. So thank you very much. Sorry, Dr. Aaron, I'm not sure if I'm seeing your hand or not. Okay, great. So thank you so much for all our special guests for joining us. Thank you for joining us, and please do not hesitate to be in touch with us. We're more than happy to engage on various things, including the various organizations that helped and contributed and participated towards this research. Thank you for your time and have a great rest of the afternoon.
Thank you.
Thank you, guys. Bye.
Thank you so much. Thanks.